Oh, are you all right? What happened? Can somebody call 911?
Got it. Hey, what's going on?
She said she fell down the stairs and her face hurts. She's bleeding a little bit.
All right. Go ahead and get that board off, please. Yep. Board off, please. Put a seat collar on her. Hey, sweetie, are you okay? Fell down the stairs. All right. Where are you right now? All right. What year is it? I'm going to put the seat collar on you, okay? It's going to be a little bit uncomfortable. Just keep your head straight and still for me. A little bit uncomfortable, okay? And just continue to hold C-spine, please, if you don't mind. We're going to get her moved and get this caught underneath her. Let's go ahead and move her all at once, if you don't mind moving her this way. This way. Yeah. We're going to bring her down the stairs. All right, sweetie. We're going to move you a little bit, okay? 1, 2, 3. All right, one more time. 1, 2, 3. And just stay like that. Keep holding C-spine, okay? All right, let's put this backboard underneath her. I'm going to get on the other side. Yeah, that's good. Will someone take over C-spine for him for just a second so we can get this backboard underneath her? Hold it. And then he will help me. All right.
You ready?
Hold. Okay, go ahead and let go. All right. We'll slide this underneath her. And once we slide it underneath her, I'm going to check her back and her head, okay? 1, 2, 3. All right. Does any of this hurt, sweetie? What about down here? Okay. Any in your legs?
No.
Okay. All right. Ready? 1, 2, 3. Roll it back over. Stand her down. We're good on the backboard. Just go ahead and help me. And you're good. Keep holding C-spine.
Lots of strips.
Okay. Cross my. Bring it out for me just a little bit. There we go. Will you give me those head blocks, please? Just the one up there.
No.
Can you send that one just a little bit? Over her shoulder. Thank you. Alright, we're going to place these head blocks here. Place this head block on this side. Just a little right. Go ahead and move it if you don't mind. Yep.
There's that one.
Sorry, sweetie, if I pull your hair just a little bit, okay? All right. I know you've got an abrasion to your forehead. We'll get it all cleaned up, okay?
Okay.
Is the pain mostly in your face?
My bad.
Okay, I'm gonna ask you those questions again, okay? What year is it?
2019.
You know what month it is?
February.
All right, and where are you right now?
Boston.
All right, you can let go. All right, if you'll help me, we're gonna get her on the cot over here, okay? Let me put this strap down.
Do you want to drop it?
Yeah, if you'll drop the cot,
Come to this side.
if you'll come with that side with her, drop the cot, and then we're gonna pick her up. Have them drop it. And
Double it up.
all the way, lift up. There we go. All right, and then two of you can come on either side. We're gonna get her moved. If you'll come over here for me. Someone get the head, please. Yep. If you'll come up and get the head for me. Come and get the head for me. Okay. Let's scoot her over so we don't hit this bar over here. We're gonna pull this way. All right, pull to your way. 1, 2, 3. Pull that way. All right. All right, we're gonna lift on 3. All right, ready? 1, 2, 3. Up. All right. Good. Yep. Right. All right. Let's put a blanket on her and keep her warm. Sweetie, can you feel my hands touching you? Yes. Okay, move your hands for me. Feel my feet? Yes. Your feet? Wiggle your toes? Good. Go ahead and then move out to the ambulance. All right, if you'll go ahead and get a blood pressure, and if you will open some oxygen, go ahead and put her on just 2 liters.
Okay.
All right, so I'm gonna cover you up with a blanket to make sure and keep you warm, okay? What's hurting you the most?
My head and my neck.
All right. Your head and your neck?
Yes.
Okay.
It's gonna be a little bit uncomfortable in your nose.
We're 88/60. 88/60. Go ahead and start me a bag of fluids if you don't mind.
Yes, ma'am. This is not, it's like moving around because of the wet.
All right, so you just put you on some oxygen, okay? If you don't mind, turn your voices. Come over here and start trauma assessment. All right, so we're gonna keep your arms in, okay? She's gonna start some fluids on you. You're a little bit, you have a low blood pressure, okay? And I'm gonna press on you, okay?
Okay.
See what's hurting you. I'm gonna take this blanket off for just a moment.
Need any help? Can you go ahead and spike my fluids for me? Yes.
This is gonna take a second. Alright, sorry, sweetie. Okay, there you go. Alright, I'm gonna press on your head, okay? Is this hurting right here?
Yeah,
Okay. I'm gonna take a look at your pupils, okay? Alright. Look at me. Alright, pupils equal round and reactive. No bleeding or CSF coming from the ears. I'm gonna press on your nose. Is this hurting you as well? Okay. Right here? Okay. I'm gonna press on your jaw. Is that hurting you as well? Okay. Thank you very much. All right, open up your mouth for me if you can. I know it hurts. Okay, I don't see any teeth missing, no airway obstruction or anything like that. Going down to the neck. Your neck is uncomfortable, correct?
Yeah.
I don't note any JVD through the C-collar or anything like that. I'm gonna come down to your chest, okay?
Sharp out.
How do your shoulders feel? Okay? I'm gonna feel.
Sharp, sis.
Can you feel me touching?
Yes.
All right, good pulses on the arms. Go ahead and wiggle your fingers for me. All right, I'm gonna press on your chest, okay? Does any of this hurt?
No.
What about your ribs right here? Any of that?
No.
Can someone hand me a stethoscope so I can listen to breath sounds, please? Deep breath.
One second, sorry.
Yeah. Patient's breath sounds are clear, equal, and bilateral. Press on your belly, okay? Does any of this hurt?
Flush.
How about down here?
No, just.
Alright, I'm going to press on your hips and your pelvis, okay? Does any of that hurt? Okay. Press down your legs.
Yeah. Once we
Wiggle your toes for me. Patient's got good PMS in all 4 extremities. IV started. Patient's on oxygen. We're here at the hospital.
Alright.
Alright. We've got everything done.
I'm closing it off.
All right, sweetie, we're gonna get you out of the ambulance, okay?
Hey, good afternoon, guys.
Hello.
Hey there. My name's Shayla. I'm going to be the nurse taking care of you. What's your name? Miss Paula, what happened?
I fell down the stairs.
Okay. Miss Callie, would you help me after you hang that up? There's a pole behind you. If you would help me get her on the monitor. And we'll start an assessment. You can give a report if you're ready.
All right. This is Miss Paula. She is a 35-year-old female. Fell on the steps of the college approximately 5 to 6 steps. GCS of 15. Remained awake, alert, oriented the whole time. Oxygen saturation was 95% on room air, so we went ahead and put her on 2 liters via nasal cannula. It's come up to 99%. Patient blood pressure was 88/60. Went ahead. She's got an IV in the left forearm, 18 gauge. So we went ahead and started 500 of fluid. She's gotten about 100, 150 right now. It has come up to 106/92. Patient's still 99% on 2 liters, GCS of 15, blood glucose of 102, no past medical history, no allergies.
Little poking, yeah.
Miss Paula, do you remember everything that happened?
I was just walking out of class and I fell down the stairs.
Okay. Where are you hurting at right now?
My head, my neck, my jaw.
She
Okay.
does have some abrasions and contusions up here to her orbital bones as well. She does have pain in her mandible, and all teeth are intact. No CSF in the ears, pupils equal, round reactive, lung sounds clear, equal bilateral. So good PMS to all other extremities. She's also got some neck pain too, so we went ahead and put her on a C-collar.
All right. Any deficits?
No.
All
Noted.
right. We're going to go ahead and call the physician. If you guys want to hang out or write your chart or however you want to do that.
Go ahead and finish my report.
All right. Thank you, ma'am. We appreciate it. We can go ahead and see if we can get the doctor in.
All right, well, here's what I want you to do then. If it's all right with you, we're gonna go ahead and run a few tests just to rule out anything serious, okay?
Okay.
All right, so let's get the lab down here to do a CPC.
Okay.
And then after they get the blood drawn, let's go ahead and send her over to imaging for cervical and facial bones. And while they're down there, go ahead and have the ultrasound people do a fast scan.
Okay. All
just to
right.
rule
Sounds
out
great.
hemorrhage.
All right, Miss Paula, we're
We'll
gonna
see
get
you in a
the
little while, okay?
lab to come in, and they're gonna draw some blood, and we're gonna get some X-rays and things. Okay?
Okay.
Any chance you could be pregnant?
No, ma'am.
All right.
Hello, ma'am. My name is Jacob Davis. I'm going to be drawing your blood today. Can I get your first and last name, please?
My name is Paula Tatch,
Your birthday?
8/12/83.
Okay.
We need an X-ray for cervical and facial bones, and we're going to get an ultrasound of her. Do a fast scan, just rule out any hemorrhaging while she's down there. Okay. Y'all can come on. Bye.
Put that gauze right there. Now, before I begin, Mrs. Paula, do you have any allergies to latex?
No, sir.
Okay.
All right. Great. I'm gonna hold a little bit of pressure on this so it doesn't bruise up bad.
All right, and we'll put that tape over that, so it won't be an issue for her. I will take these for a CBC. We have a sharps dispenser in this room.
It's
I can just-
actually it's in my office.
Okay, I can just take it upstairs.
Doing okay? Still just your face bothering you? All right, we're gonna take you down for some X-rays after we get those results back, and we'll see about getting you some medicine for pain. Okay?
Here are your results, sir.
All right.
Okay. Well, so far so good. Blood work looks pretty good. But I tell you what, I want you to go ahead and do a typing screen just in case we need to give her something later.
Can I see that order, please?
Here you go. It's just a precaution. Everything looks okay right now, but we just want to make sure we're ready if you need us, okay?
Okay.
Miss Paula, I'm gonna put this back across you so that this young gentleman can take you down to the X-ray department. I've already stopped it so we can just set it on. All right, Miss Paula, you are in able hands. I'll see you when you get back.
So, ma'am, again, my name is Kevin. This is Raquel. Can you tell me your first and last name and your birthday, please? Paul Patch. 8/12/83. Okay. We're going to take a couple images of your neck, okay? Alright, I'm going to get my system set up, and then I'm going to come in here, and then we'll take the picture, okay? Alright. There we go. X-ray. Alright, that's the first one. Now we're gonna send that image over to the doctor and have him take a look and then see how your neck looks, and then see if we can take your collar off at all, okay? Alright, just give us a minute.
Hey, Miss Patch. So far, so good. We can go ahead and take this collar off of you, okay?
All right. Give me just a second. We're going to get the handrails down. And we're going to keep her on the board. I know. All right, so what we're going to do is we're going to actually lift her on the board. If you want to just reach across, please. Don't hurt yourself. And on 3, you're going to count to 3, and we're going to move her on 3. Ready?
Alright, 1, 2, 3.
Miss Paula, they're going to get you off that board just as quick as they can.
Okay.
All right, guys.
So I'm going to put this on the top of you, okay? All finished on those pictures. I'm going to send them over to the doctor and they're going to take a look, okay? There you go.
Great news! The doctor has cleared your C-spine, so we are going to get you off of this fiber cardboard. And we're going to let you sit in a wheelchair. Alright, you just sit still for just a second. I'm going to pull the board over towards me. I know it feels like I'm going to throw you off, but I promise I won't. Alright, so what we're going to do is you're going to turn towards Miss Raquel right here, turn your legs, and I'm going to pull this board out.
There you go.
Okay, I feel a little better.
How you feeling now? A lot better. All right, you ready? We're gonna sit up. Take your time. You've been laying down for a while. Yep, we're gonna let you sit down in the wheelchair and take you for yet another test.
There you go.
All right, Miss Patch, we're gonna put you on this stretcher here. I'm Lisa. I'm a sonographer. I'm gonna be taking some images of you. This is part.
Lock on this side.
Hope you get down better. All right, I'm gonna lift your legs. Over here. Yes, please. Wait just 1 second. Yeah, we're gonna get IV pull for that. So if you don't mind, yeah, I'll hold on to this. While we're doing that, just scoot your bottom to the edge of the wheelchair. All right. Okay, and whenever you need to, put your hands at the edge here. Push straight up and stand up at the same time, and I'm gonna grab you. All right. We're gonna do a little two-step here and waddle around and get you on the bed. All right, put your bottom down. There we go. All the way back. Here. Okay. Go ahead. Just look your, expose your tummy. I'm gonna tuck you in here with some towels. You're gonna be looking at your heart, so I'm gonna just cover you up, and it'll be pretty high. Okay. Alright. I'm gonna raise the bed up. There'll be lots of warm gel for this, okay? You doing okay, Miss Patch?
Yes.
If you can, take a big deep breath in and hold it for me. Don't hold it too long. Perfect. Breathe. And one more picture. Okay, Miss Patch. Send these over to the doctor. I'm going to wipe you up. I'm going to help you sit up. Grab my arm. All right. 1, 2, 3. Let's sit here for a second so we don't get dizzy, okay? Turn your legs towards me. Let's not get you tangled up. All right. Got your wheelchair here.
Let's go this
Yeah, let's go this way. Okay. And work on this side.
Lock on this side.
All right. Big bear hug, ready, 1, 2, 3, stand up. And another two-step over here. Sit down to your bottom. There we go. All right, you put your legs back up here. All right, Miss Patch.
All right, this is Miss Patch. She's having prong breathing. Breathe is on.
Alrighty. Hey, my name is Michael. I'm from Respiratory. Can you tell me your first and last name? Alright, your date of birth?
8/12/83.
Alright, let's try to make it a little easier for you, Keith. Let's go down this way for me. I'm gonna lift the head of this bed up so you can breathe a little bit, okay? Hold your head back up for me. Just want to take a couple vitals, okay? So can you tell me a little bit what happened?
Fell down the steps.
You fell.
At school.
Ah.
My face hurts.
Your face hurts?
Having a hard time breathing.
Well, yeah.
I do have asthma.
Okay. You have asthma?
Your heart rate is a little high right now. Your saturations are a little low, so we're gonna put you on some supplemental oxygen, okay? Have you ever worn oxygen before? Okay. Now, I want you to try to control your breathing as much as you can. Okay. All right? Because we don't want you to hyperventilate. Listen to your lungs for me, okay? So just take some nice, regular deep breaths for me. Can you turn your head away from me? Enough for me? Lay back. All right, you do seem to be having a little wheezing going on, so I'm going to talk with the physician and we're going to see where we want to go from here, okay? Okay. All right. All right, back here. We got you a pole here for your fluids. I talked with the doctor and he wants to set you up on a little albuterol. Have you ever taken that before? No? Okay. Well, all albuterol is, it's a medication that will help open up those airways and hopefully prevent a lot of that wheezing going on, okay? Help you breathe better. Are you working on taking some nice, deep, slow breaths for me? Good. So how long have you had asthma? Years. Okay. I know you have that oxygen in your nose, but I'm going to hook this up to the oxygen, okay, while you do your breathing treatment. Just relax for me, okay? Lean back. Saturation has improved, so that's good. I don't want you to talk, but just nod your head for me. Are you feeling a little better right now? Okay. You don't feel as tight as you were when you came in? All right. Listen to you again. Just turn your head. Hold up a minute. You sound a lot better. You don't sound as tight as you did. Can you look over to your left over there? I mean, your right, and give me a nice big cough. Good, 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 good. Get you back up to your oxygen. Stats are looking pretty good. All right, I'm gonna go talk to the doctor now. Okay, and we're gonna I'll let him know how everything's going, and then he'll come in here and talk to you. Okay. All right. Thank you.
Hello, Ms. Patch. My name is Wendy, and this is Heather. We're from the Health Information Management Department here at the hospital. I'd like to ask you a few questions, if you don't mind, please. Can you give us your name, please? Have you been here at the hospital before?
No, ma'am.
Under any different aliases or?
No, ma'am.
Okay. Your date of birth?
8/12/83.
Do you have a power of attorney?
No, ma'am.
Okay. Or a living will?
No.
Okay. What about your insurance? We have you have it in Blue Cross Blue Shield, is that correct?
Yes, ma'am.
Okay. And who do we contact in case of an emergency?
You would contact my husband.
Okay. And do you have any known allergies?
No, ma'am.
All right. And do you want your name listed in the directory, or do you want us to have you opt out of that?
I'll opt out.
Thank you, and I think that's it for us for right now.
Thank you.
You have a good day, and I hope you're feeling better.
Thank you.
Good afternoon, Ms. Patch. How are you? All right. So from the diagnosis, we have determined that you have a fractured jaw. That's probably why it's difficult for you to speak and swallow. So what we're going to do in the next couple of days or so, we're going to go in, and this is what your x-ray looks like, and we're going to go ahead and fix that for you, okay? And we're going to also, while we're in there, we're going to fix those two front teeth that got knocked out in that, okay? So during this time, you're going to feel some different sensations, and so just kind of, if you have any type of pain or discomfort, you let us know as we're going through this, okay? So once this has taken place, we're going to give you some post-op instructions on how to take care of your surgical site, okay? So my assistant is going to tell you about how to take care of that, okay? Post-op instructions and what to eat, and how to care for it, and if you have any issues, okay? And she's also going to give you a number, so if you need to call us, give us a call.
Thank you.
Thank you.
So you're going to have some swelling that's normal for about 24 hours, so you can do 20 minutes with heat and then 20 minutes with ice, and then just go back and forth. If you have swelling more than a week or so, please give us a call. That's not normal. So the swelling should go down within a couple of days. For food, you should blend it up. Everything, because you have to drink through a straw since you won't be able to open your mouth. So you can blend up like pasta, or baby food is really good. You can do like fruits and vegetables, just all kinds of stuff. So just make sure that you blend it up before you drink it. And also make sure that you are taking your medicine as it is instructed, because you don't want to have more pain than you already do. So that's it. And then if you have any questions or anything, please give us a call. Our number is 615-475-9237. So just give us a call at any time and we will answer any questions you have. Thank you.
Hi, Ms. Patch. I'm Dr. Cornish. I'm the ophthalmologist here. And you've been to x-ray, and we've noticed on your x-ray that you may have a fracture around your right eye. So Ms. Victoria here is going to do some testing on you so that we can check that out a little bit more. And after she does the testing, she'll get back to me. And we may need to do more testing from there.
Hi, again, my name is Victoria. I'll be getting some tests and everything from you today. So I just have a couple of questions before we get started. Are you having any pain in that eye?
It hurts. My whole it just hurts.
Okay.
It
So,
hurts.
okay. And on a scale of 1 to 10, what would you rate that pain?
About a 7.
About a 7, okay. And can you describe the pain for me? Is it a dull ache or is it a sharp stabbing?
I feel like it's a sharp stab.
A sharp stabbing pain, okay. Okay. Alright. Are you having any kind of blurry vision or
I feel a
anything?
little blurry. I feel like I'm seeing a little double. I'm not feeling very well. I'm feeling like I'm going to be sick.
Feeling a little nauseous, okay. So you're having a little bit of double vision. Now when you see double, do you see the object on top of each other or side by side?
On top.
Top of each other, okay. We're going to go ahead and get some things started. We're going to check your vision and everything. If you feel like you're going to be sick, just let me know. Now, would it be okay for you to hold this over your eye, or would you like an eye patch? This is okay? Okay. So we're going to start. We're going to cover this. And we have our eye chart right down here. And what's the lowest line of letters you can read on there?
C, Z, D, R, B.
Okay, good.
C, Z, D, R, B.
Okay, good. Anything below that, or is
S, H, R, Z, G.
okay, good. Anything on the last line? Okay, that's okay. Flip that over to your other eye for me, please. And with that eye, what's the lowest line you're able to
Everything
read?
looks blurry.
Everything looks blurry. Okay. Can you make any of the top ones at the very top?
H.
Okay. That's okay. Okay. If I stayed here, can you see how many fingers I'm holding up? 3. Okay. How about here? Okay, good. Good. I'll take that from you. Thank you. So I'm just going to get you to stare at those letters. I'm just going to check your pupils, okay? So just a bright light. Good. Okay, good. I'm going to get you to stare at this green tip on my pen and just follow with your eyes. Try not to move your head. Okay, good. Let me know if this makes you nauseous. A little bit. Okay, we're almost done. Okay, good. Good, good. Now we're just going to get a quick little measurement to make sure everything looks good. Let me know if this is a little sensitive. I'm going to get close to your eye. If it's too tender, just let me know, okay? I just want you staring straight ahead. Great. Awesome. Thank you. Alright, well, I'm going to give all this information information back to the doctor. We'll get everything squared away for you, okay? Thank you.
Hi, Ms. Patch, how are you doing today?
Okay, how are you?
Doing all right. My name is Brandon. I'm a physical therapist assistant. I'm going to be taking care of you today, all right? All right, so let me go ahead and look here. Can I go ahead and have you verify your name and date of birth for me, please?
Holland Hatch, 8-83.
8283. Okay, perfect. I'm just looking at your chart here. Let me grab a chair real quick, actually. Time your level a little bit. Yeah. All right. So, looking at your chart here, looks like you took a little bit of a tumble earlier.
Yes.
Yeah.
Yes.
All right. Well, we're gonna get you back up and at 'em in no time. All right.
Thank you.
How are you feeling right now? If you could describe your pain on a scale of 1 to 10.
It was probably about a 7.
About a 7. Okay. And could you describe your pain for me, please?
Oh, it's like a stabbing, sometimes throbbing.
Stabbing, throbbing. Okay. And so we're going to call this 7, the stabbing, throbbing baseline. Okay? So this is going to be your baseline. We're going to be doing some exercises prescribed by the PT at your initial evaluation.
Okay.
And I want you to let me know if your pain increases or if it stays about a baseline. Okay?
Okay.
So I'm going to go ahead and I'm going to lower the bed down and I'm going to have you sit at the side of the bed. Okay?
Okay.
So let's get this thing down. If you want to just go ahead and sit on the side of the bed, let me know when your feet are firmly on the ground.
Okay.
Good there? All right, great. Okay, so in your initial eval, the PT prescribes some exercises. And what happens during an accident, a fall like you've had, your muscles are going to become guarded. And we need to slowly get those muscles moving again. We don't want you to stay stiff. We want the muscles to start moving. So I'm going to go ahead and give you these exercises. And I want you to follow along. But before we do these, I want you, keeping in mind the baseline that we established earlier of 7,
Okay.
I want you to just slowly and carefully look up towards the ceiling. Okay. And how's that feeling up there?
Okay.
Feeling okay? Still at baseline? A little bit, okay. And now go ahead and slowly and gently look down, chin to your chest. And how's that feel? Good? Okay, now look straight back up, and we're going to look to the left, slowly and gently. And then we're going to look to the right, slowly and gently. And how's that feeling?
Okay.
That's feeling okay?
Yeah.
All right, good. So no increased pain. We're staying at baseline. That's good. So now I want you to go ahead and just raise your arms up in front of you like this, slowly and gently. Is that feeling okay? Okay. And then to the side. Slowly.
Down.
Yep, down and then up to the side like that, slowly and gently. Is that feeling okay? And we're just gonna take our shoulders and we're gonna roll them back on both sides like this. Yeah? Is that feeling okay? And then forward. Okay. Is that feeling okay still? All right, great. So the PT has prescribed 4 exercises that we're going to want you to do at home. We have it listed. I want you to try to do them 2 times a day, and I'll go ahead and run through them with you. It's much like what we did before. So first exercise, you're just going to be looking straight ahead with a nice upright posture like you have. And we're just going to look to the right as far as you comfortably can. We're going to hold it for 3 to 5 seconds. And then from that position, slowly scan back to the left. And gently hold that 3 to 5 seconds. Okay? So we're going to do that 5 sets for 3 to 5 seconds, 2 times per day. Okay? All right, the second exercise, we're going to be here, and we're just going to put our ear to our shoulder. Gently. You don't want it to hurt. You just want to go and get those muscles moving. And we're going to repeat it again 3 to 5 seconds. So down to the right, and then slowly down to the left. Okay? All right, and then the third exercise that we have, we're going to be just looking down at our chest. Holding that for 3 to 5 seconds. And back up. And then back down 3 to 5 times. And then the last exercise that he has for you is you're just going to be looking up, gently holding 3 to 5 seconds. Okay. And how are you feeling right now? Baseline 7.
Baseline.
Still about at a 7? Alrighty, great. Well, I'm gonna send you home with those. And we're gonna go ahead and I'm gonna get you scheduled for another follow-up. Is that okay?
Yep.
Yeah? Okay. So, do you know about when you'd like us to come back and check on you?
How long does it usually take?
Well, I'll get with my PT and
Okay.
we'll discuss that.
Okay.
And he'll come in and check on you soon. Okay? All right. It was nice to meet you.